Thank you very much, grazie pour l'invitation. So, dear Chairman, dear distinguished guests, dear colleagues and friends, I'm very honored by your invitation to come here and present what we have already been doing with the International Respiratory Coalition. And I'm very happy to be here at this Italian event, which is so important to represent the coalition. I bring you also the best regards from the ERS President, Professor Carlos Robalo Cordero. He's very much committed to the goals of IRC, but he had a conflicting point in his agenda. But he sends you his best regards and also the best wishes and all the best for a successful coalition in Italy. So, as probably some of you know, but we established together with a lot of stakeholders in 21, already 2 years ago, the coalition, and we were still in the middle of the COVID pandemic. And at that time we realized really the impact that the pandemic had on our patients, and especially on general patient care, but especially on the care of respiratory patients. So the aim of the coalition really is to try to promote everywhere where we can in the national societies the lung health and to improve the respiratory care. And we have a vision. The vision is that for every country in our European region, we want to have tools where we can make use of to implement a national respiratory strategy which is based on best practice. And this is, of course, what we expect from our Italian colleagues. We want to help there where it's possible. And I think it's a very good time to really prioritize the importance of chronic respiratory diseases, because we have a lot of challenges when we are facing respiratory care. And by doing that, by focusing on these populations, we really can reduce the workforce, the pressure that is always on the hospitals, and which we have seen again last winter, for instance, the winter crisis, which brings always problems with the organizations of hospitals. So we really want to have a support for the long-term sustainability of our care system. So IRC is new, it's a new coalition. And IRC is also a unique coalition as we bring all the relevant stakeholders together, including patients. And we really want to focus on all lung diseases, on all aspects of respiratory care. So that means that we are not only looking at long-term care, but also the short-term care that we are experiencing in care when the patients do an acute infection and come to the emergency care or to the hospital. And even that can induce a very important crisis, which in this region I should not mention because you know it much better than we have seen on television. So we really want to avoid this kind of things happening. So what did we do? In 2022, last year, we already had a first important step, and the idea was to produce a new white book on respiratory diseases, but not a classic handbook, but a website. We call it the Lung Facts, and you can easily access it by looking at our website. And it's a website, so it can be a living website, but we started with the data, epidemiological data, health economic data from 2019, because they have been published, they are available widely in the community. It's derived from the global burden of disease, which is also supported by WHO. And we included the major respiratory diseases, asthma, COPD, lung cancer, acute respiratory tract infections, lower tract infections, and tuberculosis. These are the big five. But there are other big diseases in our area like sleep apnea, and there is a big group of the rare lung diseases amongst a lot of other diseases. And you will find on that website all detailed epidemiology on the data of 2019, so just before the pandemic. Please have a look there, and you can expect that next year we will have an update with the data from 21, which will be very interesting because it will include what has been happening with COVID infections. And this year, in 23, we had two major milestones that were achieved. And first of all, it's a production of the manifesto. The manifesto, which you will find later on at the end of the session, in the back. It's a really very important document for the coalition and the coalition forming. And the second point in 23 is that we are forming national respiratory coalitions. So I'm so happy to see it here becoming in a concrete form. And the manifesto really expresses our wish to reduce the burden of disease, of lung diseases. And there's a very ambitious goal. We want to follow the UN Sustainability Development Goals so that by 2030, the mortality due to respiratory diseases can be decreased by 30%. So that's very ambitious. We have all to go to work to achieve that. And to achieve that, we want to call for action on governments, on policymakers, really to establish national respiratory strategies. It's not because the pandemic has gone, or not really gone, but perhaps at a lower profile for this moment, still the end of the summer, can change. But please think about strategies to improve and to avoid too many sick patients. So in the manifesto you will find the figures for Europe, but also on the back you will find the 4 major points we want to do. And the 4 major pillars is prevention, 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 which is of course very important. As pulmonologists, as pulmonary community, we have been focusing a lot on smoking in the last year, and that was also the theme of the ERS Congress this year, climate change and pollution, which is affecting our patients very hard, and also the important role of vaccination. We have seen that effect in the COVID pandemic. But there's also a second point, access of the patient to the right treatment at the right time. It's about reduction of inequalities. And last but not least, it's also about prioritization of the research agenda, looking at data and getting insight into improved care. So as of today, I can say to you that we have 14 countries who have established or are in the process of establishing a coalition. So very happy that you are one of these. And we expect in the months to come other countries also who will jump on that train. What can we do for you? We can help you, we can facilitate. For instance, as I already mentioned, the lung facts will be expanded with new data, but also data specific for your country. And also on the page for Italy, there is already specific data for Italy, a nice summary of what respiratory diseases mean in numbers and also in euros. We can help in further development of your coalition, so we will hold quarterly meetings with all the national coalitions so that you can interact with each other in an informal way and learn from each other what are the things to do, how you can do it best. So aside from that, there will be individual meetings. You will be able to see development goals, and you can have or you can expect, if needed, help in communication, for instance, by using social media. So, dear attendees of this afternoon or this evening session, to conclude really, we have a dream, and the dream is that in every country the tools are there to implement a national respiratory plan based on the best practice. And with each coalition that is formed, we are a step closer to this. So we are very thrilled to see the launch of the Italian Respiratory Coalition. Thank you very much.